I had braces back in the, I suppose, early 80s, and they didn't do the job. I also fell off a bike, so I had one broken tooth. I had extensive work done then when I was, I think, 18, 19. And that all needed redoing around about 2003. And then I started needing root canals and decided, like, no, I need to get this redone properly. It needed extensive work. 3 of the teeth had discoloured. Basically, they were kind of dead. So I had a very uneven smile. I'd be in a pub and I'd be drinking and I'd feel teeth slip. And it'd be like, I have to go. It's just horrible, horrible situations. I had a member of staff at work who had treatment here, and he had pretty poor teeth then, as he has said himself. So I could see for myself, what a difference that made, both in terms of how he appeared and how he felt. And I had other colleagues in the hospital who themselves worked on the dental side of things, and they were recommending this place. And so, well, if these guys, who work in dentistry and maxillofacial procedures were recommending this place, this has got to be, that's high recommendation.
So initially I saw Andrew for a consultation, and it was clear that we'd need a multidisciplinary approach to the case. He certainly would need some veneers, which is what I would do, and he also had some spaces that we would need an implant opinion on. I brought Andoni straight in to assess Andrew on the same appointment. He's in the surgery right beside me. We were able to come up with a good treatment plan that Andrew was happy with, and we went from there.
Well, he's such a gentleman and so calm and like I say, so measured and just so tranquil that sets you at ease immediately. So for him to be able to explain in layman terms, what he wants to do, what he needs to do and how he's going to do it, and really simplifying things was really, really helpful, apart from just being obviously great at what he does.
So when Andrew came, we saw a couple of challenges. Firstly, on one side, he was missing a tooth already, and that had caused the gums and the bone to recede and shrink. And on the other side, he had long-lasting, ongoing chronic infections, which had eaten away a big portion of the bone around him. Here you can see a tooth, which is in good health, the bone surroundings around the root, and that's really what we want to see. When the bone is healthy, the teeth are fixed, they're strong, and for sure they're not moving. Now we can see a tooth that has a large infection, so this bone should just continue kind of a straight line from the tip of the void or the defect all the way to the front surface of the root, and that's really what we are missing here. What we have around the tooth is a lot of soft tissue, there's no bone there. That's what's causing that tooth to be loose. We have this very dark shade or halo, and that's just indicating that the infection is 360 degrees around the tooth. This is a 3D image. You can see the short roots of the teeth, and on the top you can see also a black hole or a cavity in the bone. After we extract them, we can expect the bone to have a huge void or a huge gap in this area. So the very first thing we started with Andrew was removing the teeth that were ill. We had to give the body the chance to heal for about 2 months. From the very first day, he got a fixed temporary bridge just to make sure that he wasn't left toothless. We allowed the gums and the sides to heal for a couple of months, and afterwards the rebuilding procedures began.
The big procedures were the bone graft, which was February of last year, and then the gum graft in the beginning of June last year.
Our goal was to build the bone that was missing, and that was done successfully. Once the bone grafts healed about 3 months after, we were able to place the implants, and then from there we were able to complete the work.
Well, I can now eat on both sides of my mouth. It's amazing to basically to just eat stuff normally. That obviously helps in terms of being able to smile nicely and feeling nice because I'm less subconscious or embarrassed, basically. Really professional and really, really, really nice. Absolutely first rate. I feel great. So glad I got them done. There's some people that do need to have that done or are thinking about it and see that and think, well, that's doable and I want to, explore that further about getting something done. If that helps, great. Yeah.